My name is Kirsten Fiest. I'm an assistant professor in the departments of critical care medicine, community health sciences, and psychiatry in the Cummings School of Medicine. I'm also a member of the OBrien Institute for Public Health. In my role as a faculty member in the OBrien Institute and in the departments of which I'm a member, I have responsibilities that include teaching, research, supervision, and some service work. So in terms of teaching, I teach Introduction to Epidemiology, which is a first-year graduate level course offered through the Department of Community Health Sciences. I also do research, which is what I spend most of my time doing, and my research program is focused on delirium in the intensive care unit. I also have the pleasure of supervising and mentoring students and trainees, which I really love to do. And then I'm also a member of a number of different committees within the departments and also within the OBrien Institute, where I'm the co-lead of the education portfolio as part of the OBrien Executive Committee. I would say I'm most passionate about teaching and mentoring students. I really enjoy interacting with trainees, with students, with people who are learning, trying to decide what they're going to do with their careers, getting their feet wet in terms of research and science. And I really like meeting with them, engaging with them, and hopefully helping them on their journey. I was really fortunate to have great mentorship as a trainee, and I hope that I can provide that to people as well. So right now my research is focused on looking at how we can partner with family members to prevent, detect, and manage delirium in the intensive care unit. Delirium is very common in the ICU. It affects over 50% of patients, and it can have really detrimental long-term outcomes, increased mortality, long-term cognitive impairment, and a host of functional and psychiatric comorbidities as well. And not only can an ICU stay affect patients, it can also affect the psychiatric health and well-being of family members as well. So my hope is that by engaging with family members who are frequently present in the ICU, and they want to be engaged however they can, if we can partner with them to detect delirium, to prevent and manage delirium, we might improve patient outcomes, and we might also improve the outcomes of family members. I see the next steps of my research program once we've moved past the prevention, detection, and management of delirium, which still has many years left to go. I hope that we could potentially extend this model of family partnership and engagement into other areas in the ICU that family members could participate in care, such as early mobilization, for example. And also, I would like to see this model of family engagement maybe extend to other areas in the hospital where delirium is common, such as in older adults or post-surgery. So this award is really meaningful to me because it was adjudicated by a panel of our peers, and it's really validating to receive this recognition for the work that I've done and the work I'm planning to do from the colleagues that I've work with now and that I've learned so much from over the years. The OBrien Institute has really supported me in a lot of ways throughout both my training and now as a faculty member as part of the Institute, giving me support to start my research program when preparing grants, internal peer review, and a lot of different programs that the OBrien Institute has put together to support its members. It's also supported members of my own team in terms of getting training support so I can continue to grow my own research program, which has really been quite helpful.